so my first question is going to be the hardest one. What are your predictions for the new football year?
Well, I'm excited for the football season. I think we're going to have fans in the stadium, assuming the Big Ten allows that. We can certainly do that here in Nebraska. And I'm excited to see the team that Coach Frost is going to put on the field. So I'm looking forward to it.
And we get to
play Oklahoma on the road. I think we're going to have a winning season. Absolutely.
Perfect. Well, let's jump into COVID-19. The state's open for the most part. Lots of new events coming up. How do you think the state handled COVID-19 during this last year?
We struck the right balance here in Nebraska between slowing the spread of the virus and allowing people to live a more normal life. We took steps to be able to make sure that people could get a hospital bed, an ICU bed, or a ventilator when they needed it. And that was what we really made all of our decisions around, was being able to provide that acute care for people who were going to require that. And then making sure that we could allow people to have the other things that go along with living the good life here in Nebraska. And I think if you look at the statistics, we've been able to keep our mortality rates down. We've been able to provide that hospital bed. We're one of the states with the highest percentage of people who are 65 years and older that have been vaccinated. So that's protecting the most vulnerable people here. So all that's gone very well. And at the same time, we're one of the states with one of the lowest unemployment rates. We've been able to get our kids back in schools. We're the #2 state for getting kids back in schools, so that's a big deal. So it's been a balance that we've struck here that I think has been successful.
Is there anything you would change looking back on March 2020 to now? Is there anything you would change in the state's response to the virus?
Yeah, there isn't anything major we would change. I mean, we made the best decision we could at the time with the information we had. And so I'm not one to go back and try and second guess decisions that we tried to do the best job we could. Certainly if we'd known the pandemic was coming, we would have stocked up more on PPE or things like that, but we didn't know those things, so we just did the best job we could.
Could we see big events like the College World Series back in Omaha this summer?
Yeah, absolutely. So with our directed health measures, we're really not going to have any restrictions on any sort of outdoor events, and the only real restrictions we have right now are for indoor events of 500 or 1,000 people or more. You have to work with your local health director to get a plan put in place, but you can even still have those events, you just have to have a plan in place.
What about the people in the stands? I mean, they're crowded, there's tens of thousands of people that could be in those stands. Is that maybe going to be something that we require masks for? Is that going to be up to maybe Omaha or the baseball? Like, who's going to be in charge of making that decision?
Well, ultimately, the NCAA will probably have their own restrictions with regard to what you can do with regard to the stands. We from the state really won't have any. And when you think about it, by the time we get to June, we're going to have a large proportion of people who are vaccinated. Now, if you're one of the people who chose not to get vaccinated, and if you're in a risk group, like maybe you're older, then yeah, you probably should either avoid the event or wear a mask when you go. But it's really going to be up to the individual to make that determination.
I want to talk about the most recent stimulus bill that came out with the Biden administration, kind of their first really big push in his term as president. What are your thoughts on that stimulus bill, and how is that going to help Nebraska?
Well, first of all, I think that by penalizing states like Nebraska who have a low unemployment rate, you're sending the wrong message. All the previous stimulus bills were based on a per capita, and they're divvying up the money based on unemployment rate. So basically, they're penalizing states like Nebraska that have tried to strike the right balance and have a low unemployment rate. We will, take those dollars and look to see if there are specific industries that need help. We're going to have to get the Treasury guidance to know what exactly we can do with this. So we're really kind of in a wait and see mode right now to get that guidance to know how we can actually spend the money.
What did you hope to see come out of this stimulus bill from the Biden administration that maybe we didn't get?
Well, I got to tell you, quite frankly, Nebraska is not in a situation where we need a lot of dollars coming to the state. I mean, I think there are still opportunities for certain industries, like the hospitality industry, that has certainly been impacted by the pandemic and continues to be impacted. But here in Nebraska, our revenues are running well ahead of forecast. In fact, our forecasting board just met and increased our forecast by $462 million over the next 3 years. So again, by striking that balance, one of the things we've seen is our revenues at the state are actually running ahead of forecast. So we've got the opportunity to do a lot of things here in the state that we maybe haven't had the chance to do, but the stimulus, again, is something that we'll take a look at, but it's not really needed from the state standpoint.
With the higher revenue, is that maybe a bit of a surprise, considering we came out of a time of a pandemic where businesses were closed, the ag industry was impacted? to see a higher forecast, that's kind of almost a surprise to hear.
Well, I think part of it is, first of all, Nebraskans did a great job during this pandemic of taking care of each other, of taking the right steps when we asked them to take the precautions to slow the spread of the virus. And that's what helped us to strike that balance. I think also, if you look at Nebraska, our number one industry is agriculture, less impacted by the pandemic because we still need to feed the nation. Manufacturing is our second biggest segment, relatively unimpacted by that. So, and we also have large segments around things like insurance that were relatively unimpacted by the pandemic as well. So I think it just demonstrates, that Nebraskans are resilient and have a lot of grit and determination, and that when it comes to these emergencies, they pull together to get through them. I think that's what's leading, for us to have such a great recovery here.
So that's, I guess, a good outlook for the 2021 kind of fall harvest season and things for ag producers and farmers and those small business owners.
Yeah, I think actually, what we saw was farm income in 2019 was better than 2018. In 2020, it was better than 2019. Now that was largely due to a lot of transfer payments from the government. But with commodity prices up, I think we're actually looking at a pretty good year for 21 for the farm economy as well.
So I want to turn to vaccine rollout. We've been on it for a few weeks or a few months now. How has that been going for the state of Nebraska, and has it been going as you expected it to?
Yeah, I think the vaccine rollout is going well. We certainly were looking for ways to continue to improve how we're doing because we want to get as many vaccines in people's arms as we possibly can, as quickly as we can. We focused on the right group, the people most at risk. So our phase 1A was around long-term care facilities, the staff and residents there, as well as healthcare workers. And then we moved into 65 years older and up, because 83% of our deaths in Nebraska have occurred in that age category. That's the single highest correlation is age to whether or not you may pass away if you got coronavirus. So we focused on that, and as I said, we've been number one, or at least in the top 4 states, with regard to the percentage of people getting that vaccination of age 65 or higher. And I think that's really helped us out tremendously. And we're going to continue to focus on the next group, which will be 50 to 64. And then really, I'm looking at pretty quickly here, we're going to be able to open this up more broadly.
So Governor Reynolds announced yesterday that any Iowan should be able to get the vaccine come about April 5th. Is there kind of a time frame for all Nebraska residents to maybe get that jab that they're hoping for?
Well, we're going to focus on, some of our local health districts are going to be moving to this already, getting to those 50 to 64-year-olds, because that's the next group that's at risk. So for example, if you look at 50 to 59, that cohort had twice as many deaths as all the cohorts 49 and younger. So again, age is still a big determination here. So we're going to focus on that group, but as we get through that group, and a lot depends on the uptake, how many people want to get the vaccine. We certainly encourage people to sign up and get the vaccine now, because we're looking at that group right now. So get signed up at vaccinate.ne.gov so you can get the vaccine. But once we get through that group, we will be moving on to the broader population.
Has the state received the vaccine allotment that they'd hoped for or had planned for from the government?
Well, we certainly would like to get more vaccines. The federal government distributed the vaccines based upon your population above the age of 16. So relatively speaking, Nebraska got fewer because we're a younger population. Having said that, the federal government has been able to increase the vaccine allocation over the course of the last several months, and we've been able to get the vaccines that we were told we were going to be able to get and could plan for. We're looking forward to the week of March 29th, because that's when we should start seeing more Johnson & Johnson vaccines coming into the state, perhaps 10 times as many as we're getting right now. And that'll be good news for us to be able to help, again, knock out a lot more people with the vaccines, get a lot more people the vaccines.
And there's still a lot of people who are hesitant to get that vaccine, maybe for the rush that they feel that was behind the rollout, or maybe for different views. Do you have a message for those who are saying maybe not yet?
Yeah, certainly, the vaccines are all 100% safe and effective at keeping you out of the hospital and keeping you from dying. So they're safe and effective. Please get the vaccine, because that's at the end of the day how we work our way through this pandemic. So we want people to get educated on it. The state has a campaign that we're running right now. There's other groups out there like the Do Right Now campaign that is funded by private interests. We're working directly with different communities of color to be able to do outreach there. Our local public health director is doing a great job on that. So we've got a lot of different efforts to communicate out. We do want people to get educated, but these vaccines are safe. We want people to get vaccinated, because that's how when we get enough people vaccinated, then the virus can't spread.
Have you been vaccinated yet, or will you be?
I have not been vaccinated yet because I don't fit into the category we prioritized, so I'll be waiting my turn just like everybody else. I have signed up on our website, so I'll wait till I get that notification, and then when it comes my turn, I will get vaccinated.
So turning now to kind of some stuff moving through the legislature, there was talk of making carryout alcohol permanent in the state of Nebraska. I know that was a thing that took place over the pandemic when businesses were closed to in dining. Is that something you would support for the state?
Yeah, actually, it was my executive order that allowed for carryout alcohol as part of the ways to help our bars and restaurants. And again, bars and restaurants are still being impacted. And what we've seen over the course of the last year is that it really didn't have an impact on some of the things that people were concerned about, like drunk driving. So I think we can do carryout alcohol and do it in a safe way. And so I support Senator Geist in getting that done.
There's also a new bill kind of moving through talking about health education standards in elementary school, talking about gender identity and a bunch of different things that maybe not all parents or guardians are okay with.
So is there a bill on that, or is that the new health standards?
I think it is the health standards.
Yeah, I think you're talking about the State Board of Education has put out some guidelines, and I have said that they should be scrapped because they're sensitive topics, sometimes politically controversial, and sometimes things that just the parents should handle. And age inappropriate. That's a key thing, age inappropriate. They allowed political activist groups to be a part of this while ignoring some mainstream groups with regard to this. So those standards just need to be scrapped, and what I encourage is parents to go to the State Board of Education site, read the standards, and contact the State Board of Education and give them your feedback. That's what really needs to be happening, is parents need to give their feedback directly to the State Board of Education.
Because they're really talking about starting some of these like gender identity issues as young as like kindergarten, first and second grade.
Yeah, and one of the things that they're, for example, one of the things that they're talking about is they talk about in kindergarten, talking about consent. Now, certainly talking about inappropriate touching is one thing, but kindergartners can't give consent. You can't do that in Nebraska until you reach your late teens. So this is something that's completely inappropriate. Another, they talk about different family structures, but they don't talk about heterosexual family structures, which is the one I grew up in. Mm-hmm. So there's a lot of things here that are just, they're bad and need to go away. And that's why it really is important for parents to weigh in on this.
Is there a place for an educational standard like this in Nebraska schools? Should that be something maybe the school districts decide, or?
Well, again, this is the first time that the State Board of Education has done this for these youngsters, people this young. And I don't understand the need for this when they have other standards already that apply to the older grades. Again, this is where parents really need to weigh in.
So turning to medical cannabis, it was nearly on the ballot this last election cycle, and there are still a lot of supporters who want to see it on the ballot come this upcoming election cycle. Is that something you support at all, or what could be done to make you sign that should it be on the ballot?
Well, what the people who want to use medical uses for marijuana should do is go through the Food and Drug Administration, like has been done for some drugs. There are drugs like Epidiolex that takes abstracts from cannabis or chemicals from that to be able to create drugs. That's the way we keep people safe. That's a regulatory structure that protects all of us. By avoiding it, which is really what these big pot companies want to do, is they want to avoid regulation. There's no such thing as medical marijuana. It can't be prescribed by a doctor. It doesn't get distributed through a pharmacy because it's not gone through the regulatory process. They can't do that. So it's not a medical product. And so that's what it leads to all the really disastrous things we've seen in other states, where we see, marijuana can cause psychosis and schizophrenia in people. We've seen that. In fact, the Denver Post just editorialized on the increase of psychosis and schizophrenia in young people because of marijuana use, and is calling for more controls on it because they're seeing that impacts in Colorado. They're seeing more youth suicides with youth having marijuana in their system when they commit suicide. So we can see the really disastrous effects it has on young people. And that's why I'm telling people, if you want to have this, you need to go through the Food and Drug Administration like we do for all other drugs to make sure they're safe and effective, and not go around that, and not basically deregulate the pot industry.
Are there any other bills moving through the legislature that you're kind of keeping an eye on, or maybe looking forward to for the state of Nebraska?
Well, there's a number of things that we've proposed in my budget proposal that we want to see get done. For example, we proposed putting together veterans tax relief to get the second half of the relief that we got last year. That will allow us to be more competitive with states like Iowa and South Dakota that don't tax military retirement benefits. We tax half of them here, so we want to make sure we're on a level playing field with states like South Dakota and Iowa so that we can hold on to our veterans here. That's an important one. And we also have a rural broadband bill to make sure that we're connecting those 80,000 Nebraska households that don't have broadband access right now, so we can start connecting them so that they can get that 25 megabit download, 3 megabit upload speed that is really kind of basic table stakes to be able to participate. And this is important for working remotely, remote education, e-commerce, entertainment, telehealth. All these things really rely on this, and so it's important that we really connect all these Nebraska households, just like we did for rural electrification and rural telephone.
With broadband, has that been made more of a priority now in the face of COVID-19 because education at home and working from home and telehealth has become so prominent so quickly?
Yeah, certainly the pandemic has really highlighted how hard it is to work from home or have that remote education, and if you're on the wrong side of the digital divide, it really makes that impossible. And so I used $29 million of the CARES Act money we got last year to start connecting about 17,600 households. And now what I propose is another $20 million in each of the next 2 years to get 30,000 more households.
Is that going to be charged to taxpayers at all?
Well, it's be using state taxpayer dollars to be able to do that connectivity, but we're also doing in conjunction with the the companies, the telecom companies that would do it, where we would partner with them to get that done, where they would put up some money, we would put up some money, and then of course they would have to actually deliver the high-speed access.
Looking kind of broad picture, we do have a new administration in Washington. What do you hope to see come from the Biden administration over the next 4 years?
Well, what I would like to see from the Biden administration is reaching out to states to really have more of a partnership, understanding that there's, especially if we're talking about emergencies like pandemics, they are locally executed, state managed, and federally supported. Having the federal government try to go around and manage it directly from Washington is only going to lead to a one-size-fit-all answer. So, for example, when you hear the president talking about people getting together at 4th of July, well, people here are already doing that. When he talked about getting to the general population by May, well, that was part of our plan from a couple months ago. So, I think that if you're in D.C., you tend to think that there's the same thing that's going on in D.C. going across the rest of the nation. It's just not true, especially not here in the Midwest.
So, big picture, what are you looking for? What are you looking forward to for 2021?
Well, we want to make sure that we're continuing to work to end the pandemic here by getting people vaccinated. That's how we get through this ultimately. And then we're going to have to continue to take steps, but I think that we're going to get there sooner rather than later. Probably by the second half of the summer, we'll be getting back to a more normal way of life. And then what we got to do is just continue to focus on how we create the opportunities for Nebraskans to, send their kids to school, go on that family vacation, and enjoy the good life here in our state. And that means creating jobs, having those opportunities for our folks to take those jobs, and that's what we were about before. We had done a very good job in winning the Governor's Cup for the most economic development projects per capita. Obviously, the Siouxland area has been very good at that as well. So that's the kind of thing we got to get back to, is really creating those job opportunities for Nebraskans.
So we're in a tri-state area. We've got Iowa, Nebraska, South Dakota, where we're located at. So we have viewers from all over the place. If they're looking for, maybe their next little road trip, why should they choose Nebraska to come visit?
Well, I think one of the things is, again, just we've managed the pandemic here in a way that has really struck that balance. So I think coming to Nebraska is a great opportunity versus maybe some of the other states that are, going to be more shut down, and you'll have more opportunities here. But, we've got to just, as you're looking for that vacation, we've just got a lot of wonderful things here in the state to be able to enjoy. And because we haven't had the same impacts of other states, maybe on the coast, you're going to be able to enjoy more of it. So whether it's, going to the College World Series or the Henry Doorly Zoo or taking that trip out to Scottsbluff National Monument, you're going to just find more that's going to be open here in Nebraska and more to be able to enjoy.
Anything else you want to add in?
Just that I'm very much looking forward to getting the vaccines out to people. Let's get through this pandemic. Just hang with us for a couple more months. Please sign up at vaccinate.ne.gov. But just hang with us for a couple more months, and then we'll be getting back to that more normal place and really be able to start enjoying the things we enjoyed before the pandemic.